We have a lot of different things that we can do for rheumatoid arthritis, and it is very unusual nowadays to have a patient who does not respond to any of the treatments that we have.
Rheumatoid arthritis is a highly inflammatory disease, primarily involving the joints, although it does affect other tissues. It affects usually women much more than men, especially in the childbearing ages. It tends to start in the mid-30s, and it peaks in between the 30s and 60s and then drops off a bit after that. It affects all races fairly equally, whites, blacks, Hispanics, Asians, except for one group, which is Native Americans, and they do have a much higher genetic susceptibility to rheumatoid arthritis than other groups.
So rheumatoid arthritis is diagnosed with three key components. One is the history, the chronicity of the symptoms. You're talking about swelling, pain, stiffness in the morning that's very prolonged, more than 30 minutes to an hour in smaller joints. So we're talking about wrists, fingers, ankles, toes, and feet. Combine that with a physical exam where the rheumatologist can verify that all of those joints are involved, active, and inflamed. That's what we call a synovitis. Plus, there are laboratory tests that are extremely helpful, which are antibodies against rheumatoid factor and CCP, or citrullonated peptide. And in some cases, we can order imaging or x-rays to document any changes that could look like RA. So this sounds like a perfect process. Often it's not. It takes more than one visit to the clinic to figure this out. But really with careful history taking, examination, and the right laboratory tests.
So rheumatoid arthritis is a type of inflammatory arthritis. So other types of inflammatory arthritis, like psoriatic arthritis, for example, can have the inflammatory features that rheumatoid arthritis has, but it has distinct features that allow us to tell the difference between rheumatoid arthritis and other forms of inflammatory arthritis. It is a type of inflammatory arthritis, and it is not wear and tear arthritis like osteoarthritis, which is a type of non-inflammatory arthritis.
The rheumatologist is very important in diagnosing and treating rheumatoid arthritis. In areas where there are not many rheumatologists, there are some states where there are very few. You might have to depend on your primary care doctor for diagnosis and treatment, but rheumatoid arthritis is misdiagnosed fairly frequently because there are many types of arthritis, and if it's the wrong diagnosis, you might end up with the wrong treatment. So it's good to have confirmation, at least from a rheumatologist, that is the correct diagnosis, and if possible, have that rheumatologist help decide what treatments you're on, even if you're followed primarily by your primary care doctor.
This is a disease that is with you for lifelong, but it doesn't mean that it has to affect your life in every way. We focus on getting your symptoms down to the lowest disease activity possible, which will often take a combination of different medications, and making sure that we prevent the onset of real damage, structural damage to the joints, as well as any other organ involvement.
If rheumatoid arthritis is untreated, it can cause severe damage to the joints. This may be small in the beginning, you can't see it, but over time the damage to the bones that comprise the joints or the cartilage in between the bones gets eroded. The tendons and the ligaments that keep the joint tight and intact may be inflamed and rupture. Then the joint becomes dysfunctional, can dislocate, or have other abnormalities, and then require surgery.
We have a lot of different treatments for rheumatoid arthritis. So right now, I think we have a very strong toolbox of medications to use, but there's always new developments in terms of pharmacotherapies. We're also learning about how and when to treat patients earlier, and even maybe treating patients before they even have symptoms in order to stop the RA from happening entirely. And that's a very exciting area of the treatment, to think about maybe being able to halt the disease before it ever becomes clinically meaningful for a patient. So at Columbia, I think the uniqueness about getting your treatment for rheumatoid arthritis here is that we have providers with a lot of expertise and experience in treating rheumatoid arthritis. And we don't use just a one-size-fits-all approach for our patients. We use a very individualized treatment approach for all of our patients.